You know what nobody talks about at family dinners or neighborhood barbecues? The quiet changes that happen to a man's body after 60. The ones that make you feel like you're somehow less than you used to be. Maybe you've noticed it yourself. Things that used to be spontaneous now require planning. Moments that used to feel natural now come with hesitation. And the worst part, you're convinced you're the only one going through it. But here's the truth that might surprise you. You're not broken. You're not failing. And you're definitely not alone. I'm Dr. Lena, and I've spent the last 12 years as a urologist, helping men just like you navigate exactly this situation. Today, I'm going to walk you through what really happens to men's intimate health after 60, not with embarrassment or shame, but with clarity, compassion, and real solutions that actually work. Before we dive in, do me a favor. Hit that like button if you've ever wondered about this topic but felt too uncomfortable to ask. And drop a comment telling me where you're watching from. I love connecting with viewers from around the world. If you're new here, subscribe and turn on notifications because we're building a community where men can learn about their health without judgment. Now, let's talk about what's really going on. Here's what most men believe by the time they hit 60. That declining intimate function is just part of getting old, that there's nothing you can do about it, and that wanting to maintain an active, fulfilling, intimate life somehow makes you inappropriate or unrealistic at your age. Every single one of those beliefs is wrong. Let me be crystal clear. Aging does change how your body responds. That's physiology, not failure. But the idea that you should just accept decline, that vitality ends at a certain birthday, that wanting connection and closeness is somehow undignified after 60, that's not medicine. That's shame masquerading as wisdom. In my 12 years working with men of all ages, I've seen 62-year-olds with better circulation and response than some 42-year-olds. I've worked with 70-year-old patients who, with the right understanding and small adjustments, completely transformed their confidence and quality of life. Age affects function, yes, but it doesn't define your potential. Not even close. The problem isn't your age. The problem is that most men don't understand what's actually changing in their bodies, why it's happening, and what simple, practical steps can make a real difference. They suffer in silence, convinced they're beyond help, when in reality, knowledge and small lifestyle shifts could give them back comfort, confidence, and connection. That ends today. What I'm about to share with you isn't about chasing your 25-year-old self. It's about understanding your 60-year-old body, respecting what it needs, giving it the support it deserves, and reclaiming the dignity and joy that every man has a right to feel, regardless of age. Over the past 12 years, I've had thousands of conversations with men in their 60s, 70s, and beyond. And here's what strikes me every single time. The relief on their faces when they realize they can talk openly, when they learn they're not abnormal, when they discover that what they're experiencing has names, causes, and most importantly, solutions. The men who do best aren't the ones with perfect genetics or expensive treatments. They're the ones who understand what's happening inside their bodies and make informed, consistent choices that support their health. They're the ones who stop blaming themselves and start working with their biology instead of against it. That's what this video is about. Not quick fixes or unrealistic promises, just honest, evidence-based information delivered with the respect and care you deserve. So let's get into it. I'm going to walk you through the 5 most important changes that happen to men's intimate health after 60, what they are, why they happen, what they feel like, and what you can do about each one. Ready? Let's go. Change number 5. Blood flow becomes less efficient. Let's start with something that affects almost every man over 60 to some degree. Changes in blood flow. Now, I know blood flow doesn't sound particularly exciting, but here's why it matters so much. Intimate function, everything from readiness to response, depends entirely on healthy circulation. When blood moves efficiently through your body, reaches the tissues that need it, and stays where it's supposed to, everything works smoothly. But after 60, that process naturally becomes less efficient. Why does this happen? As you age, the walls of your blood vessels become slightly less flexible. This is called endothelial dysfunction, basically. The inner lining of your arteries doesn't relax and expand as easily as it used to. At the same time, plaque can build up over decades, narrowing the pathways blood needs to travel through. Add in common issues like high blood pressure, high cholesterol, or diabetes, and suddenly you're asking your circulatory system to do the same job with less than ideal tools. What does this feel like? For most men, it shows up gradually. You might notice that responses take longer than they used to, that spontaneity isn't as reliable, that sometimes, no matter how much you want something to happen, your body just doesn't cooperate. And that's frustrating. It makes you second guess yourself. It makes intimate moments feel like tests you might fail instead of experiences you can enjoy. What can you do about it? This is where small changes make a surprisingly big difference. First, movement matters. Cardiovascular exercise, walking, swimming, cycling, literally trains your blood vessels to work more efficiently. Even 30 minutes of brisk walking 5 times a week can improve circulation measurably. You're not training for a marathon. You're reminding your vascular system how to do its job. Second, what you eat directly affects blood flow. Foods rich in nitrates like leafy greens, beets, and pomegranates help your blood vessels relax and widen. Omega-3 fatty acids from fish support arterial health, and reducing processed foods and excess sugar prevents further plaque buildup. Third, hydration is non-negotiable. Dehydration thickens your blood and makes circulation sluggish. Aim for at least 8 glasses of water daily more if you're active or live in a hot climate. Finally, if you're dealing with high blood pressure or cholesterol, work with your doctor to get those under control. These aren't just numbers on a test. They're direct predictors of circulatory health, which is the foundation of everything else we're talking about. Better blood flow doesn't just improve intimate function. It gives you more energy, sharper thinking, and a body that feels more like yours again. But circulation is only part of the story. Up next, we're talking about hormones, and this one surprises a lot of men. Change number 4, testosterone levels decline gradually. All right, let's talk about testosterone. You've probably heard about low T in commercials or online ads, and maybe you've wondered if that's your issue. Here's the truth. Testosterone does decline with age, but it's more complicated than most men realize. Starting around age 30, testosterone levels drop by about 1% per year. That's normal. By the time you're 60, you might have 20 to 30% less testosterone than you did in your prime. For some men, this drop is barely noticeable. For others, it's profound. Why does this matter? Testosterone isn't just about intimate drive, though it absolutely affects that. It also influences energy levels, muscle mass, mood, motivation, and even cognitive function. When testosterone drops significantly, men often describe feeling like they're running on fumes. They're tired more often. They've lost interest in activities they used to love. And yes, intimate desire and response can diminish noticeably. What does this feel like? Imagine wanting to feel connected to your partner, but just not feeling that spark. Or feeling ready mentally, but not physically. Or noticing that recovery takes longer, that you're more irritable, that your confidence has quietly evaporated. Low testosterone doesn't announce itself with fanfare. It sneaks up slowly, and by the time you notice, you've been adapting to it for years. What can you do about it? First, get tested. Don't guess. If you're experiencing symptoms like persistent fatigue, low libido, mood changes, or reduced physical response, talk to your doctor about a testosterone panel. Morning levels are most accurate, so request an early appointment. If your levels are genuinely low, testosterone replacement therapy, TRT, might be an option. But, and this is critical, TRT isn't right for everyone. It comes with risks, especially if you have a history of prostate issues or cardiovascular disease. It's not a magic bullet, and it requires careful medical supervision. Natural support matters too. Resistance training, lifting weights, or doing body weight exercises stimulates testosterone production. Getting 7 to 8 hours of quality sleep is essential because testosterone is primarily produced during deep sleep. Managing stress through mindfulness, hobbies, or counseling prevents cortisol from suppressing testosterone. And maintaining a healthy weight helps, since excess body fat converts testosterone into estrogen. You also want to make sure you're getting enough zinc, magnesium, and vitamin D nutrients directly linked to testosterone production. Many men over 60 are deficient in at least one of these. Testosterone decline is real, but it's not a death sentence for vitality. With the right support, medical or lifestyle-based, you can maintain healthy levels well into your later years. Next up, we're addressing something that affects comfort and confidence in a very personal way. Change number 3. Sensitivity decreases over time. Here's something most men don't realize until it's already happened. The nerve sensitivity in intimate areas naturally decreases with age. Think about it this way. When you were younger, even subtle stimulation could produce a strong response. But as you get older, that same level of stimulation might not register the same way. It's not that you've lost feeling entirely, it's that the threshold for sensation has quietly shifted. Why does this happen? Nerve fibers, like everything else in the body, age. Over time, peripheral nerves can lose some of their efficiency. Conditions like diabetes accelerate this process significantly, causing what's called peripheral neuropathy damage to the nerves that transmit sensation. Even without diabetes, decades of wear and tear mean signals don't travel as crisply as they once did. What does this feel like? For many men, it shows up as needing more stimulation to feel aroused, or feeling present mentally, but somehow disconnected physically. It can make intimacy feel like work instead of pleasure, which then creates anxiety, which makes the whole situation worse. It's frustrating, isolating, and rarely discussed openly. What can you do about it? First, protect your nerves. If you have diabetes, keeping your blood sugar well controlled is absolutely critical. High blood sugar damages nerves over time, and once that damage is done, it's often irreversible. Work closely with your doctor to maintain healthy glucose levels. Second, avoid behaviors that compress or damage nerves. Prolonged sitting, especially on hard surfaces, can reduce blood flow and compress sensitive areas. If you cycle regularly, make sure your seat is properly adjusted and supportive. If you have a desk job, take frequent breaks to move around. Third, stay engaged. Neural pathways that aren't used regularly become less responsive. Maintaining intimate activity with a partner or solo keeps those nerve connections active and reinforced. Think of it like muscle memory. Use it or lose it applies here too. Finally, consider pelvic floor physical therapy. Yes, it's usually recommended for women, but men benefit too. A specialized therapist can help you strengthen muscles, improve circulation, and enhance sensation through targeted exercises. Reduced sensitivity doesn't mean you're doomed to numbness. It means you need to be more intentional about supporting the systems that make sensation possible. Coming up next, we're tackling one of the most common and misunderstood changes men face after 60. Change number 2, response time increases. Let's talk about something almost every man over 60 experiences, but few feel comfortable mentioning. It takes longer to get ready and longer to recover. When you were younger, arousal could happen almost instantly. Recovery time, maybe minutes. But after 60, that process slows down. What used to be spontaneous now requires patience. What used to be immediate now takes time. And if you don't understand why, it feels like failure. But it's not a failure, it's biology. Why does this happen? Remember that blood flow issue we talked about earlier? It plays a huge role here. When circulation is less efficient, it takes longer for blood to reach and fill the tissues necessary for function. Combine that with reduced nerve sensitivity and declining testosterone, and you've got a perfect storm of delayed response. The refractory period, the time it takes to be ready again after climax, also lengthens with age. In your 20s, that might have been minutes. In your 60s, it could be hours or even a full day. That's completely normal. It's not dysfunction. It's your body's natural rhythm at this stage of life. What does this feel like? Honestly, it can feel humiliating if you don't understand it. You feel pressure from yourself, maybe from your partner, to perform the way you used to. When your body doesn't respond on command, anxiety sets in. And anxiety is the enemy of arousal, creating a vicious cycle that makes everything harder, no pun intended. What can you do about it? First, adjust your expectations. This isn't about lowering standards, it's about respecting reality. Your body is doing exactly what healthy 60-year-old bodies do. Spontaneity might look different now, but that doesn't mean intimacy has to suffer. Planning, patience, and communication can actually deepen connection. Second, focus on overall arousal, not just physical readiness. Mental and emotional connection matter more as you age. Create environments that support relaxation and closeness. Reduce distractions. Prioritize comfort. The more holistic your approach, the more successful you'll be. Third, talk to your doctor about options. Medications like sildenafil, Viagra, or tadalafil, Cialis, work by improving blood flow, which can significantly reduce response time. They're not for everyone, and they're not a substitute for addressing underlying health issues, but for many men, they're genuinely helpful. Finally, be patient with yourself. Rushing creates pressure. Pressure creates anxiety. Anxiety kills arousal. Give your body the time it needs, and you'll be surprised at what's still possible. Slower response time doesn't mean you're broken. It means you're human. And there's dignity in working with your body instead of against it. All right, we've reached the most significant change and the one that affects daily life more than anything else. Change number 1. Prostate health directly impacts function. If I could make every man over 60 understand one thing, it would be this. Your prostate health is not separate from your intimate health. They're completely intertwined. By age 60, more than half of men experience benign prostatic hyperplasia, BPH, which is just a medical term for an enlarged prostate. And by 80, that number jumps to 90%. This isn't cancer. It's not inherently dangerous, but it absolutely affects quality of life, comfort, and yes, intimate function. Why does this happen? Your prostate sits right below your bladder, wrapped around the urethra. As it enlarges, it starts squeezing that tube. Suddenly, urination becomes difficult, weak stream, frequent trips to the bathroom, that feeling like you never fully empty. And because the prostate is also involved in reproductive function, an enlarged or inflamed prostate can interfere with arousal, response, and even sensation. What does this feel like? Imagine waking up 3 times a night to urinate. Imagine planning every outing around bathroom availability. Imagine feeling uncomfortable during intimacy because of pressure or discomfort. It's exhausting. It's frustrating. And it quietly steals your confidence because you feel like your body is betraying you. What can you do about it? First, get screened regularly. A simple digital rectal exam and PSA blood test can catch issues early. Yes, it's uncomfortable. Yes, it's awkward. But it's infinitely better than dealing with advanced problems down the road. Second, dietary changes can help. Foods rich in lycopene, tomatoes, omega-3s, fatty fish, and zinc pumpkin seeds, nuts, support prostate health. Limiting caffeine and alcohol, both bladder irritants, can reduce nighttime trips to the bathroom. Third, stay active. Regular exercise reduces inflammation throughout your body, including in the prostate. Pelvic floor exercises specifically help maintain muscle tone and control. If symptoms are moderate to severe, talk to your doctor about medications. Alpha blockers relax the muscles around the prostate,